Well, good evening, everyone, and welcome to the Health Overview and Adult Services Scrutiny Committee. Could I ask colleagues, please, to mute their microphones and turn off their cameras? If they wish to speak, please use the chat box and I will see it, or if for some reason I do miss it, then just come in, unmute your mic and come in and say you wish to speak, and that will be fine. Okay, our first item on the agenda, declarations of interest. Mr. Mulholland.
No, that's any of the members have any interests, Chairman.
Thank you.
They can now
any declarations? Say. No declarations. Thank you. Urgent business?
None, Chairman.
Apologies for absence.
I've just got one. That's Councillor Darvesh, and Councillor McMulkin is deputising, and he's on the meeting.
That's great. Thank you. The minutes of the previous meeting, and you've had a copy.
Could be agreed as a correct record, yeah.
Yeah, can we agree those as a correct record, please? Is that agreed?
Agreed. Yes. Agreed.
Thank you.
Agreed.
Thanks very much. Could I just bring up a quick comment, please, on page G7? This is the page that refers to the previous meeting's decision to set up a special review panel of inquiry into the COVID-19 outbreak in our borough and how it has affected the borough. It's just to bring you an update on this. I have spoke to the Chief Executive about this, and he's fully supportive of a panel of inquiry being established. However, at the moment, to take senior medical officers away from their vital roles which they are carrying out is not something I would want to do, and I'm sure members of the committee would not want me to do that either. So on that basis, we're not kicking it into the long grass, we're not kicking the can up the road, but what we are saying is at this moment in time, it wouldn't be appropriate to set up the inquiry, but we will set up the panel as soon as is practicable, given the circumstances within the borough. I just thought I'd bring that to your attention to let you know that obviously we're still going ahead. Councillor Sherrington, did you have a question?
Thank you, Chair. I'm waiting for my red box. All right, we're live now. Yes. Right, what it is relating to the spokesperson from the care homes, and unfortunately I've actually read all the documentation, and then since I've read it I can't actually find it to actually pull it back to tell you exactly which page it is, but what there has been a reference to this grant that has come from the government for care homes, and I know that there's 600 million that's going to go out to the rest of the country now on like a second wave, and I'm just curious to find out if this is going to just be for care homes again, or is it going to be for people who are caring in the community, like for instance home care and so on. So I was just wondering if that was the case. And the other thing as well, there's two questions here. The other one relates to the fact that on the LGA, which we get through on a daily basis, which is the local government association, send us information. A couple of weeks ago, it referred to the fact that in certain areas of the country, and it didn't actually specify where, that care homes were getting 50% more than their normal fee if they were actually taking in residents or patients from the hospital who had actually had COVID-19. So I was just wondering if this had happened at all in Bolton. Thank you.
Just wondering, Chairman, if some of this will come up under the item 7, because we're in danger of opening new areas, aren't we, under the minutes? That's all. I just thought I'd just highlight that.
I think obviously it's whatever the officers are happy with. If they're more comfortable to leave this to item 7, then I'm sure Rachel and other officers might wish to come in and give us an update on Councillor Sherrington's concerns.
Or I can ask it again anyway. Okay, thanks, Chair.
Thanks, Councillor. Okay, so item 5 is the committee work programme, and there is a report enclosed. And as we've said to councillors, the work programme is not set in stone, and as the year progresses, or indeed at any time, if there's anything that you really feel is pressing, by all means let us know, and we will include it in the work programme to satisfy your questions or your anxieties about any specific subject. So please don't think that what you see before you this evening is set in stone. It is not.
And just to highlight, Chairman, that following this meeting, the list of items previously suggested by members will be, following a discussion with yourself and the Vice Chair and the officers, put into a schedule.
Thank you. I've got a question from Councillor Sue Howarth. Councillor Howarth.
Thank you, Chair. I first want to highlight that I've suggested that we look at primary care, general practice and health centres if possible. Demand is rising sharply. We only have to think about the flu campaign, but also those under COVID where, you know, they say that they have issues with their mental health. And I mean, that's one of the reasons behind wanting to have a good look at these subjects, and also because there's potential for new delivery solutions and the need for the public, I feel, to be consulted if we're going to have some of those. The other thing I want to mention is there's a big title on this work programme called Health and Social Care Integration, Strategic Commissioning Function and Integrated Care Partnership. And I know that I emailed in some words to say, please, can we have a look at black and minority ethnic inequality pertaining to things in this subject matter. Some matters are urgent, and we want to have some collaborative action going forward on these matters across health. But of course, it's to note that that big title there, that for me, they're still two separate things, aren't they? Because people will be aware that commissioning across health and social care is, in layman's terms, meaning what is chosen to be the services for the people of the borough, and also perhaps what might not get chosen by commissioners. And then the integrated care partnership is very much about health and care providers and delivery of services and coming together in integrated care to aim for some of the best outcomes in health and social care for the people of the borough. So I'd be grateful if you might consider whether some of that might be split up if other members really want to start to be able to contribute and give their views as councillors as to that subject matter. Thanks very much.
Thanks, Councillor Howarth. Does any officer wish to speak at this stage to Councillor Howarth regarding our comments, or are you quite happy for these matters to go forward to a further meeting?
Chair, I'm happy to pick it up in the work programme setting.
Okay, thank you. I think that's Rachel. Thank you. Okay, so item number 6 is the Director of Public Health, the annual report, and the joint strategic needs assessment, the JSNA. I think Dr. Lowy is going to lead on this.
Members have had the report already.
Yep.
Thanks, Helen.
Thank you. Yeah, I'm delighted to present to you all tonight the Bolton's Public Health Annual Report from the Director of Public Health, myself. As you're probably aware, it is a responsibility, statutory responsibility to present each year the health and well-being of the population of Bolton. And what I've put in my first annual report, so I've been here just over 12 months, so this is for 2019/20, is really understanding of what the health and well-being of the people of Bolton, looking at the breadth of work that's happening across the borough by the council, by our partners, and also most importantly within our communities. It really does align to the Bolton's vision as well, and it's really what's really pleasing to see through Bolton's vision is underpinned by the Marmot principles. What as well, you know, it's really recognising is that overview, and it's also a way of an introduction to the Joint Strategic Needs Assessment, the JSNA, which we'll come on to in a minute. But what the report does, it brings together a selection of key population health indicators and from a range of sources. It looks at it from created a shared picture of our health and well-being, and looking at the factors what influence our health. What I've also put in is that around having this, in my first year here in Bolton, we've created a new public health directorate within the council. So we work centrally right across all the directorates across the council, but also with other partners, and using the Healthy Weights Declaration. We've also worked with our public health team to develop a public health strategic business plan to refocus our efforts to ensure that the best place to deliver on the Bolton's vision for 2030. And we've also sought out the new arrangements for our health and wellbeing board in Bolton, again aligning them to the Bolton's vision so that we have an active, connected and prosperous board. Again, focusing on improving our health and well-being, but also on reducing inequalities. And finally, produced a JSNA, which I'll come on to in a minute. I don't plan to go through the documents. You have got the documents, and I'm happy to take any questions at the end. This is a high-level summary, and it is the start of a work programme as well that we have, which, as I say, I'll come on to in a minute with the JSNA, because they're very much linked together. What I just want to draw your attention to, though, is towards the back of the document. Again, it sets out what you know anticipates and the next steps really for us here in Bolton. Obviously, COVID in 2021 will have a significant impact, and I'm sure that the folks of the next annual report will have a strong COVID focus. And please bear in mind, as I said before, this is a 2019-20 annual report, so just before as COVID was hitting. But again, what I really want to just highlight is the next steps. And we are launching our JSNA to ensure that our strategic decisions are intelligence-led, decisions focused on improving outcomes for everyone, short-term, medium-term as well as long-term. Inequalities does remain embedded and is a priority for our active, connected and prosperous board. And as I say, there'll be a focus on COVID-19 as well in relation to the inequalities agenda. Undertake an adverse childhood experience prevalence study that will again give us a better understanding of our information and knowledge across Bolton. Drive the intelligence-led approach, and again continue to lead Bolton's multi-agency intelligence hub, which we've already got established. Again, we'll be bringing into the next part of my presentation, and then continue to lay the groundwork for the Healthy Weights Declaration. Again, having a whole systems approach through policy, engagement and advocacy, so to support people, residents of Bolton, to live and age well. And finally, the sixth part of the next step is to reviewing our pharmaceutical needs assessment that we have in place, that we need to put in place, and we have already one in place, but has to be renewed every 3 years. Just so people are aware, it's actually due in 2022. It has been put back due to COVID, and that's a national decision for that, but it does take a good 6 to 9 months to have a proper full consultation, plans in place, data analysis and capture to have a comprehensive P&A, a pharmaceutical needs assessment. So that will also be our priority of our work programme going forward. So That's it for the Public Health Annual Report. If I may, could I go on to the JSNA presentation? And John, have you got the JSNA presentation here? And so it links really nicely, as I say, the JSNA and the Public Health Annual Report link extremely nicely. So as John just loads that up, we can move on to that, and then happy to take, as I say, questions at the end. So thank you for that, John.
All right, give us 2 seconds.
My head's in COVID, you see, at the moment. So what I've just gone through there is the actual document, the PDF document that you'll have all received in your papers. As I say, is that report, and this bit is the Bolton's Joint Strategic Needs Assessment. So next slide, please. So just going to quickly go through why a process for a JSNA is important, what it actually is, what it delivers, the governance that we have, and showing you our new JSNA website, as well as mentioning, as I say, the pharmaceutical needs assessment. Next slide, please, John. Oh, did we go to there? So what we need, why do we need a JSNA process? Well, it really supports the Bolton's vision. It is very ambitious, as we know, and what we need to have is that access to and effective use of insight of our local insight, and also our intelligence, pulling all the information together from a wide range of sources so that we have robust basis for our strategies and for our actions that we do. The JSNA is a statutory duty. It is the joint responsibility of both the local authority and the CCG, which is discharged by the Health and Wellbeing Board. So for us in Bolton, we call it the Active, Connected and Prosperous Board. And it facilitates the delivery of a pharmaceutical needs assessment. And just again, to remind people that the pharmaceutical needs assessment, the P&A, is a separate statutory duty to the JSNA, but they do run alongside each other. Next slide, please. So what is a JSNA? Well, it's a set of local systems and processes. It's not just one static document, it is a live document, and it's also a process with strong leadership at the heart of it. It creates an objective summary of health and needs and wellbeing needs that met by our local authority, our CCG, and also NHS England. So it's bringing together the three organisations. It's recognised and shared by all partners and our local communities. And we can also include more detailed assessments such as ward level, specific topics or population subgroups. And again, or wider issues that influence health, such as employment, crime, community safety, planning, housing. Next slide, please. What it delivers for us, so what's the importance of it? Well, it has that shared understanding of what our health and wellbeing needs are, what our inequalities are, and what our wider determinants of health are for us in Bolton. It gives us access to data, intelligence and insight on population, health and wellbeing, and as I say, the wider determinants of health, the housing, employment and so on. It supports the culture of insight and actually supports that intelligence-led working, which is so critical to the decisions that we make. And it informs priorities for the strategic action, and again links very much back to the active, connected and prosperous, both the vision but also our outcomes framework. Next slide, please. It also is about being able to deliver a range of products, and as I say, it's not just one static document, but a range of products to support a shared and consistent story of the health and wellbeing. We have a dedicated Bolton JSNA website, which I'm going to show you in a minute. We also have data and intelligence digests. So the Public Health Annual Report will go on this website. We also have used the intelligence and evidence to inform and support Bolton's fund, and also we have summary text to support strategies, bids and so on. Infographics that we may develop will go on here, as will presentations and slide sets that we do, all linking back again to the health and wellbeing of our population. Next slide, please. As I mentioned before, the pharmaceutical needs assessment, again, just to ensure we've got the context here, it is a statutory duty, it's separate and distinct to the JSNA, and it also has that wider pharmaceutical. So if there are any changes, it can be made for Bolton. It's a basis. What we need it for is that basis for determining the market entry to pharmaceutical list, and it's used by NHS England to inform decisions on the commissioning of pharmaceutical services. We do already have a P&A in place, and there's a link there on the slide set that you can go and access it. And the current P&A is valid until the March 2021. You'll see on the website. However, this has been suspended because of the COVID-19. So we're looking to refresh it next year for completion, as I said before, in 2022. Next slide, please. It's important to have a strong governance in relation to the JSNA, and we have, as I say, we've got the Health and Wellbeing Board, because it is a responsibility discharged from that, and we have the JSNA and Outcomes Leadership Group that is jointly chaired by Councillor Baines and also Mel McGuinness. So it's joint between the local authority and the CCG. So we've got that joint accountability, because that's what's required for the JSNA. And underneath that, we have an operational group, and we also have a P&A working group that's set up as and when required for the cycle period for that. And then we'll have particular task and finish groups as and when required. I'm not going to go into the detail, but it's outlined there on the slide what the leadership group is and what the operational group is for. Next slide, please. We have got the link to the JSNA website. We do recommend using Chrome for it for best experience, but it is available. It's freely available. I'm sure that you've all been using it throughout COVID-19, because there is a dedicated section on the website there that has all the information about COVID-19, but it also has about our population, our deprivation, our wider determinants, and again, it'll be supported on the further information that's in the Public Health Annual Report. So the two very much align to each other. I'm not going to go through the website there, but I'm happy to take any questions unless there was a real ask for linking onto the website. But as I say, it's freely available for everybody to access. So I'm going to pause there and take any comments.
Chair, you're on mute.
Thank you very much, Helen, for that. I've got a question from Councillor Sherrington, a question from Councillor Mistry, a question from Councillor Heslop, and then a question from Councillor Howarth. Councillor Sherrington, please.
Thank you, Chair. My question relates to you said about bids that you can actually, which I presume bids means that you can actually apply for money. And I was just wondering if you've got an area as a ward that has got a lot of health problems, can you actually apply for any of these bids direct to your ward? Or is it just bids that are for Bolton as a whole? Thank you.
So what the JSNA does, it supports the process for the Bolton's Fund. So the Bolton's Fund is a wider initiative across the council for various community activities and so on. And what we do is we provide the evidence of either some of the particular priorities that we think are challenges across Bolton as a whole, and also, you know, again, whether it's looking at different population groups, whether it's aligning it to the Marmot principles. So involved in the process as such for the actual bids that you're talking about, but what we do using the data and intelligence is to help develop those criteria, what's required, and that's what we use the intelligence for. Thank you.
Thank you, Helen. I've got a question from Councillor Mistry. I think it's concerning the JSNA report. Councillor Mistry.
Thank you, Chair. Just going back to the report, I'm just more interested in crime and violence. I noticed the figure of domestic violence has been greatly increased from 2016 going back to 2009. Is it because of COVID-19 and during the lockdown period? And is it possible for you to give us a breakdown per ward, just to give us an indication of where this particular area of crimes increased? Thank you. Okay. Oh.
Sorry, I kept on muting myself then. In relation to the data itself for this report, it goes up to 2020, so it's before COVID came into being. So this doesn't take none of the data at the moment in there actually specifically takes into account the COVID. So we haven't seen the impact yet of COVID. And that will be looking at it more from going forward for next year's report. So the data that's in there at the moment doesn't reflect 2020 data. So for that part of your question, the other part of the information is we only have what we have available, and not all information is down to ward level data. This is for a whole host of reasons, whether it's because the numbers are too low or because it's not published at that particular level. So at the moment we don't have any further information. That said, we are looking at different ways of collating some information. So for example, the adverse childhood experience study, again that's been delayed because of COVID. But that again would be asking to understand our prevalence of ACEs, adverse childhood experiences, which includes domestic violence. So we would have a better local picture in there. Thank you.
Thanks. So thank you, Chair.
You're muted, Councillor Donegan.
Thanks, John. Question from Councillor Heslop. Paul, please.
Well, thank you, Chair. Yeah, Helen, this is going back actually to what Councillor Mystery was saying in your response. And now I have looked on just looked on the website, sorry, and it all seems very Bolton centric. Even the imagery is there all about Bolton. And you did put emphasis on localism. My concern is a lot of the events that are taking place in the wards, such as Kersley, is unreported, and there'll be no action taken there. So what robust procedures are in place to check for certain areas of the borough where there is a dearth of facilities, and it may well be that a lot of this is going unreported. And actually on the ground level, how will you find this information out? We've got one super surgery in Kersley, virtually no communal facilities, and they could be reported through voluntary organisations. So I'm just wondering how you're going to gather this data from areas like Kersley. And again, is Kersley going to be short-changed and the facilities are not going to be in place purely because there's no reporting mechanism for these issues? Thank you very much.
Okay, thank you for that. And it's a really good question. I think what this is the start of the journey, as it were, to, as I say, for the Public Health Annual Report, giving that overview of a summary of where we're at across Bolton, to give a flavour, because I felt that we didn't have that in place, and so hence putting that Public Health Annual Report in place, so we've got that understanding of the breadth of the information. We do have more information on different parts within the system, but again, it's about taking the work and putting it into more of a detailed information. It's about the assets as well as the needs. Now, some of that will be done from a bottom up. It will be done from the engagement part around what information, what assets do we have, and that's what we intend to collate on an ongoing basis. But when you look into the JSNA website, it does have things that are lower super output area or a middle super output area, or indeed a ward level information. So there are some aspects within the website. Again, it's not a finished product, and it's going to be built on and built on. This is the start of it, of how we have that greater understanding of our information across Bolton. Thank you.
Thanks again, Helen. And Councillor Howarth, please, a question. Sue?
Thank you, Chair. Thanks. So this is the annual report from the Director of Public Health. It's independent and it's to the Council, and it's very, very important, and I welcome it enormously. So I'm thinking broader, if that's okay, which is about, I'd say it's always the same with, you know, reports that come up every year, or even less frequently than that. So the impact, if you like, on the council and those that are active in the council, which is officers, but also cabinet members. And I hope it's appropriate that I want to just give a comment to page 32, which of course is the diagrams that show by ward mortality for men and women. And if you look at that, I was thinking about the distances to the town centre of Bolton, the centre of everything, Bolton, where a number of services are, where people have to travel to get services. And I looked at the area south. I looked at south, where we've got some of the dark colouring, and first of all, actually, I don't represent Kersley, but I thought of Kersley. My ward is in the south, so I know the south quite well. And I thought, you know, from the border of Kersley, it is quite a distance into that central area for Bolton Town Centre, where we've got services. And then I was reminded that if we have any services of health and care, whether they're NHS type services, council services, or even the smaller type services where the voluntary sector and community sector are doing quite a lot now with us, with services, I should say, then something placed in Kersley, I know it helps then Farnworth, and part of Farnworth, of course, is in Harper Green. So I want to get an understanding from the executive members if that is something that they consider very much, because I'm not sure. I was thinking, I picked two ideas of service provision out, and that was, say, mental health, access to mental health, and then also young people's health services. So I was thinking for mental health, I was thinking single point of access mental health, but also the very good voluntary sector that we have. A lot of it is Bolton centric, and also the young people's health service. For example, we've got that fantastic Parallel, again, Bolton Town Centre. And I want to get a sense from the executive members, are you thinking about these distances, and are you thinking for the political work? You know, when you look at the statistics of poor health, there's no getting away from it. We've got these issues in Kersley, in Farnworth ward, and obviously Farnworth, my ward. These areas, particularly at a distance from the centre of the borough. So I want to get a sense if the executive members would give me a view on whether you yourselves politically are really thinking about this. Thank you, Chairman.
Councillor Baines, did you want to come in?
Yeah.
Thanks, Susan. And Councillor Morgan afterwards. Thanks, Andy. Susan, yes, please.
Thanks for that, Councillor Howarth. We are very, very mindful of these issues across the wards, and obviously all our wards are so very, very different, and each of them has its own specific needs. And that's bringing us back really again to the JSNA, looking at the needs assessment across the wards, and really looking and reflecting on what each particular part of the borough actually needs. And one of the things, there'll be quite a lot of task and finish groups that are being set up to look at the various strategies, I should say, which we require. But one of the things, again, would be driven by the Children and Young People's Board, as you referred to mental health. And we've already got a task and finish group looking at that. We're actually looking at the needs of specific populations across the borough. And there's lots of really new and exciting initiatives coming forward for that. You're probably aware of the chat service for mental health, which is a really dynamic strategy now, where young people, if they are concerned about their mental welfare, they can contact professionals who are there to respond and help them. And that will be across the borough. It won't need anyone actually moving along and trying to travel into the centre of town. So we're very, very mindful of how we can actually meet the needs individually. And that's something obviously we'll be moving on. So yeah, okay, I hope that answers your question from my perspective. Thank you.
Thank you.
Thanks, Susan. Councillor Morgan, did you want to come in?
If I could, please, Chair.
Yes, of course, Andy.
Thank you. Yeah, I think I absolutely agree with what Sue's just said, but we need to think about thinking outside the box with regards building-based services. It's all about the neighbourhoods and delivering the services where they're required. And as Councillor Howard said, you know, within specific wards, there are different demographics, different community needs, and that's why we're progressing our 9 community-based sort of areas, so we can respond and provide the services that are needed there and then. Like you say, Kersley might have a need 1 week, 1 month, 1 quarter, and it might have something different. So it's allowing us to be as flexible as possible to meet the needs of the community. So we're doing hopefully moving towards exactly what Councillor Howard wants with regards providing the services that are needed by that community at the time, and it's not specifically building based. Thank you, Chair.
Thank you.
Thank you to Helen, and obviously to the 2 executive cabinet members for that useful update. I have no more questions on these matters in the chat box. So with that, I'm going to move on to item number 7, which is the COVID-19 update. And I believe Rachel Tanner is going to do this in conjunction with other officers who may wish to come in and talk to us.
Great, there's the presentation.
Thank you, Chair. Helen Lowy is going to start and we'll hand off to various people. A combined effort.
Sorry,
you've
got me again.
Thanks, Helen. I thought I would give you 5 minutes for a cup of tea, but here you go, you're on again.
No, we keep going. So yeah, so I'm going to start and then I'll hand over to colleagues in a minute. So next slide, please, John. What this slide is, I'm just giving you an overview of obviously the number of confirmed cases. So this is people who have been tested positive for COVID-19, either through the Pillar 1 testing route or Pillar 2. The Pillar 1 is through our health and social care system, and Pillar 2 is our community testing sites across the community. So what we can see as well is that obviously the beginning there, the 7-day, the orange line, by the way, is a 7-day rolling rates, and we do look at 7-day rolling rates so that we can smooth out some of those peaks and troughs that we see happening on an individual basis. And we'll see that what you can see there at the beginning, sort of in the April time, as the numbers were high and then came back down, and then the peaks in the second wave as we're coming into now for COVID-19. Just also remind people that we only use public health, only uses the data from 5 days or more because it's completed, can be considered complete. Also just reminding people that sometimes you might see the data that's slightly different. That's what's on our website, and as again, it's on the JSNA website. Because we use the information from Public Health England and the Joint Biosecurity Centre, and as I say, there is a 4-day lag period, so that's what we consider is the most accurate information. So next slide, please. This slide here are the trends in deaths for people who have died with COVID-19. Again, just to put it into some context, week 1 is the first week in January there. So as you see, weeks 12 to 24 and so on is the first wave there. Again, over the March, April, May periods, and the red boxes there are deaths that happened within hospital, and the light blue is where deaths occurred within care homes. And then obviously there's also within hospices as well as personal homes and elsewhere. Up until as of the 22nd of September, we have there have been 329 deaths for people who residents within Bolton. Next slide, please. Again, this is data that we had from as of yesterday. It is up to the week of the 22nd of September, and as I say, that's because we have those few days where from when it's published with the information, so it is accurate. And our rates was 248 per 100,000, and you'll see on the right hand side there how our rates have increased over the recent weeks, as you'll all be aware. Yeah, so 709 cases of COVID in the last 7 days. Next slide, please. Just to say as well, from a summary of our confirmed cases, obviously the case numbers do remain high and our rates do remain high. Most of our confirmed cases currently arising from Pillar 2, so the community swab tests that, as I say, across the community. The drivers of transmission we believe remain largely within the community, within and between households, but obviously there's also an increasing number of cases being seen within schools and also workplaces. We do look at clusters and we look at outbreaks, and this is just a snapshot of where we've been in the last fortnight. It's probably actually changed since I presented the slides yesterday, but it just gives you an indication of some of the clusters that we are investigating through our contact tracing programme, and also to say that our highest proportion is shifted slightly from an age demographic perspective to the 35 to 44-year-olds, but it is dispersed across all of the age groups. From an ethnic perspective, 42% have been diagnosed, and this is in the last 2 weeks. In the white British, the Asian Pakistani 15%, Asian Indian 12%, and 21% have ethnicity missing. And it's important to highlight that 21% don't have that completed on their forms. We do know that cases are concentrated in our most deprived areas, but however, having said that, from a ward level and an MSOA perspective, cases are widespread right across the board. And again, on the JSNA website, there is the ward level data that is produced on a Monday and uploaded onto the JSNA website every Monday on a weekly basis. Next slide, please. We also lead on the contact tracing programme from a Bolton perspective in a local context. And again, just putting for information there, so it's quite a complex system for contact tracing. So this is as cases have tested positive, people are called up to who have been in close contact. Tier 1 is for complex settings, and that's managed by our local public health team, but also by the Public Health England through a GM integrated hub. And Tier 2 and Tier 3 is carried out by the National Test and Trace programme. As I said, Bolton were part of the GM's integrated test and trace hub, Tier 1. Sorry, that should say Tier 1 for complex settings and contacts. It's the automatic, it goes the opposite way. You'd think the Tier 3 would be complex, but it's not, it's the Tier 1 that's complex. Just to say as well, from a Bolton's perspective, we are slightly lower from a national average and similar to the Northwest for our uptake on contact tracing. Again, that's from a national perspective, and the local our local contact tracing service in Bolton is currently receiving between 80 to 90 contacts per day to chase up. Bolton is a pilot for Tier 2, as is other areas across Greater Manchester. So these are new arrangements for those cases and those contacts who were uncontactable or could not be reached by the national NHS test and trace call handlers. Our feed for Bolton went live on the 10th of September, so it's a relatively new part of the programme, and we have seen a significant increase with volume and also the timeliness of the cases received. We do have, as I say, for our local contact tracing service, we do have a single point of contact. It is a 7-day-a-week service. It also links with our response hub that we have here in Bolton, and we do have a public health on-call duty officer at all times, again 7 days a week. We work really closely, as I say, with our Public Health England colleagues, and also this is where our local schools will also contact us if they have questions that they may want to ask about the who are close close contacts and if they have a case within their school environment. So next slide, please. And on that, I am now going to pause and I'm going to stay quiet and I'm going to hand over to Rachel Tanner for the testing part, please. Thank you very much.
Thank you. So just a brief summary in relation to the COVID testing. Can I just check, can people hear me okay? Thank you. So on this slide, I've just emphasised really where our testing sites are, and this is Pillar 2 testing, which is testing for the public and other workers through the national portal. So all testing sites are bookable through the national portal. We have no local control over this, but we have been working closely with the Greater Manchester team and the national teams to ensure we have capacity prioritised for Bolton. And we have 3 long-term sites now available across the borough, and I've just put the details up there for you. Now these are drive up and walk in, so you can't just walk in without booking, so you have to come with your QR code and the other details that will be available. We also have, in addition, 2 temporary test sites which previously were supported by the military, and they're on Moor Lane and Leverhulme Park. Moor Lane is a drive-through site. We have 2, as you'll notice on there, on the Moor Lane site available to us, and the Leverhulme Park, and that is a drive-through and walk-in by appointments. Now, how long the temporary sites will be with us will depend on where our rate is and pressures in other areas to increase capacity elsewhere, but we certainly were prioritised to increase capacity with our rate being so high. We have had significant issues which have been well publicised both nationally and locally, and what I would say is that the role of the locality is to liaise with Public Health England, the Department of Health and Social Care, and with the independent providers who provide the actual facility for the testing. We also have to provide the sites. So we are continuing to look at other sites across the borough for more long-term sites, but it isn't a quick solution. We have had access to the temporary sites within a matter of 24 hours, which has been really positive. There was significant issue with accessing the national portal that everybody had heard about. That has eased over the last couple of weeks and the flow is better. We in addition did have the support of our foundation trust in accessing Pillar 1, which is priority within the hospital labs for NHS staff, inpatients and outbreaks, whether that's in care home or other settings, but also support in an extreme situation for, say, schools, social care or primary care if there was a resilience issue. We haven't actually had to use that yet, but it's really great that we have that partnership locally to ensure that we don't have full closures or business continuity issues. We also did, when we were at the beginning of the local restrictions for Bolton, we were working with Public Health England around asymptomatic testing. So that's targeting individuals who aren't showing symptoms, who are in the age categories of the younger age brackets, who we know potentially are more likely to be asymptomatic, to try and educate, and we're prioritising in terms of giving out test kits to return. We did, when the issues were happening nationally with the portal and the access locally, we suspended that and got agreement nationally to do that and redirected those kits to schools and other areas as a first priority. I would say education though is still a key priority, and testing will remain a challenge, and access to laboratory capacity, which we are working and escalating through the daily meetings that we are having with the Department of Health and Care around when that will come on stream. National issues affected us locally, and I'm pleased that we have the local partnership support to help resolve some of these issues, but will be one that we will continue to monitor closely. So I think I'm going to hand over now to Fiona Noden. Yeah, thank you.
Hello there. Can you hear me okay? So good evening, everybody. So I'll just give you a brief update of where we currently are in the hospital and the community setting. So currently we remain in a command and control setting in Greater Manchester, which means that we are in under GM Gold that's managed through daily meetings with all acute providers. We're anticipating, as Rachel's alluded to, and so has Helen, a challenging few months ahead. We've got a requirement to balance the usual winter pressures against the second wave of COVID and continue to safely optimise our services to ramp our services back up to the level of where they were pre-COVID, so we can make sure that we can deal with our elective patients. The challenges are quite different from March. Insofar as our capacity regarding our workforce and our physical elements of the organisation are limited because we're entering a winter period. We know that some of our staff are going to be affected, and they have been, so our sickness rates have risen slightly during the last few weeks. Next slide, please. So our plans for winter, we've learned a huge amount over the last few months about how we've responded to the first wave of the virus. That puts us in a really strong position to deal with the second wave. Our clinical teams are really much more knowledgeable. They know what they can do, they know how to anticipate, and they know how to deal with our patients. We've got enough PPE. This was an issue during the early first wave. We have enough PPE, and we've got other equipment should we need it, and we receive mutual aid through working with Greater Manchester and through the Greater Manchester command and control system. We've embedded many new ways of working, so video consultations is certainly one of them. Our staff continue to work really well so that patients are discharged safely. We've done a huge amount of work working with our community teams and with Rachel to ensure that we can discharge our patients safe to their homes. We've recruited key staff to ensure that our organisation is safe and that our workforce is resilient. And we've put in place wellbeing services for psychological support for all our staff, which is available 24 hours a day, 7 days a week. So our biggest challenges for the next few weeks and months. The continued demand on urgent services. I think when I spoke to you last, we'd seen a significant reduction in the level of patients requiring urgent services. We're back at pre-COVID levels now. The requirements to make sure that we're delivering our cancer and elective patient pathways safely. So we're using the Beaumont as part of the independent sector to make sure that our patients are able to access safe services, and we continue to deliver our cancer services as they need to remain. The NHS Phase 3 expectations are very clear and they're very challenging. So an expectation that we'll restore our service to 70% of pre-COVID levels during September, and I'm pleased to say that we're there. We have to rise that activity to 90% by October, and that's going to be really challenging for us. And there's an expectation that we're going to have 100% restoration for all our diagnostic services by October. Again, that will be challenging given the estate of the Bolton Hospital. We do know that the demand for COVID-19 testing is rising, and as Rachel's already alluded to, the testing requirements have been quite challenging, but we've delivered very well, and we continue to work in tandem with Phase 2 testing. The the Pillar 1 testing in the hospital has significantly ramped up over the last few weeks, and we're now delivering 205 tests a day. I'll pause there and hand back over to Rachel. Thank you.
Okay, can I have the next slide, please, John? So from an integrated health and care perspective, just wanted to highlight a few issues really where we've continued to respond to COVID and highlight some of the challenges. And as Fiona said, you know, many of the good ways of working that we adopted in COVID have now been embedded. We will be conducting face-to-face where appropriate, but many of the services will be kind of ring first to ensure people don't have symptoms and we can work safely. One of the biggest challenges has been the restarting and stepping back up of services across the board, and that's social care, primary care, community and housing. And some of the services that we'd want to step back up to support individuals are limited due to restrictions and to protect the most vulnerable because of social distancing. So we've had to look at creative ways about how we can respond. As Fiona said, the phase 3 targets for the NHS will remain challenging for us, but so far we've been rising to that challenge. I won't kind of labour the points really, kind of we've already covered, but I think generally across the health and care partnership, and I include housing in there too, the staff are very knowledgeable now as to what the impacts of COVID can be, and the lessons we learnt have been shared collectively. The pressures we had in March of PPE have been resolved. We've got enough stocks of PPE and access now for care sector from national routes and LRF routes. And the infection control measures are embedded well now, and we've seen kind of good management, especially across our care home sector, keeping any kind of significant outbreaks really down to the minimum now, where we haven't seen any. The planning for the demand that we can expect over winter with COVID is well underway, and we're working with our social care providers to make sure we've got capacity in the right place to support people with hospital discharge, and I'll come on to the social care winter plan shortly. We're working with primary care as well and other services about our resilience plans, about how we make sure that we can offer mutual aid and business continuity across the piece. And staff wellbeing is a key factor in there, in terms of staff have been working at a really immense pace throughout COVID, and we're trying to ensure that staff wellbeing is a key priority. As I said, care homes are continuing to manage well across the board, but there are significant demands on them from many angles of technology, undertaking testing, and they are carrying a high number of vacancies, but our sector in Bolton is managing to continue at this route. We are also across the board in community trying to maintain contact with the clinically extremely vulnerable, shielded, to reinforce messages and make sure, and that's through primary care and the specialist community services too. A few challenges. Our demand has gone up right across the partnership in terms of back to normal levels, and in some areas has increased because of the impact of COVID and the restrictions on individuals. And we are prioritising reducing harm and prioritising the most vulnerable as we are trying to step those services back up. The challenge, like as I said, restarting those services and delivering them differently, and our workforce. One issue that we are very minded for is the legal requirements in Bolton and Greater Manchester that care home visiting is not currently permitted, is causing some families and relatives a level of distress, and we are working hard to look at how we could introduce that and lobbying to lift this as soon as we are able to, and working with government on that. Testing, and the only other issue I'd say that hasn't been mentioned is as well as the flu vaccinations and the extended groups. Primary care are working hard, and pharmacy to roll out the flu programme, which is a key pillar to supporting the vulnerable people in the borough. Can I have the final slide, please? Thank you. So just for Scrutiny really to be aware that the winter planning for social care, the adult social care winter plan was launched last week on the 18th. And we will be providing a response to that by October. What I would say is there isn't anything radically different to what we've already been working on as a whole partnership to support people with social care needs. But we have had some confirmed funding for discharge pathways for up to 6 weeks. And also, as Councillor Sherrington asked earlier on in the committee, there has been an announcement of a second round of infection control fund for care providers. We're waiting for the guidance. The first round was very much targeted to care homes. We expect the second round to be less focused on care homes and probably the wider care sector, but we'll await the guidance and our allocation, and we'll probably update it a further committee as to how we've administered that. As I've mentioned, free COVID PPE for providers until the end of March, and we're working through the pathways how to access that from next month. And it is a collaboration of all partners to the winter plan, and it covers the key areas that have been mentioned there that we will, it may well be that we can bring back through the response to the winter plan at a future committee if members are interested. So I will pause there, and it's the end of the presentation and open up to any questions to any of us. Thank you.
Thanks, Rachel, and thanks, Helen. I'm looking for questions in the chat box. I can't see any questions. Have any members any questions, please?
Yes, please, Chair.
Yeah, okay, so it's Councillor Howarth and then Councillor Heslop. Councillor Howarth, please.
Thank you very much, Chair. I want to just talk about a change that's happened around test and trace, and then just form a question around that, please. So yesterday was the first day, Chair, where it's taken a while, I'm afraid, to get to this, to find some finance from government to pay those people who have really struggled for fear of losing work, in particular, to comply, if you like, with certainly with the trace aspect, where they would need to take time off, and we know that is for 2 weeks, you know. And now yesterday is the first day where the £500 for 2 weeks has kicked in, and of course I think the actual finance might start to come later, though, mid-October, but people can apply, and this is particularly people in jobs who can't work from home, and many in frontline work, some who don't have particularly stable contracts, like cooks, bar workers, drivers, cleaners, many people who live in the borough. And I mean, that's one change. So I want to get a sense from officers about trace, just a bit more about trace, and about test. If we've heard about the difficulties the public are still faced with in being able to book tests, but of course in Bolton we've got good provision. Thank everybody for all the hard work on that. And as I ask this question, again, to acknowledge all the hard work that's gone on by everybody involved in protecting the public as regards COVID, the non-stop work, actually, the ceaseless work for services like public health. It's just to get a bit more of a view, please, Chair, on certainly on trace, and what we think, how we think things might change in terms of public response in the weeks ahead. Thank you.
Thanks, Sue. What I'm going to do is I'm going to take a couple of questions. I'm going to take one now from Councillor Heslop, and then I'll ask the officers to reply, if that's okay. Councillor Heslop, please.
Thank you, Chair. It's actually a bundle of questions, short ones, hopefully. Firstly, I've looked at the trend in confirmed cases, and the very last date it appears to show that the figures plummet. I don't know if people can see it on the presentation. I've got a printout here. Well, it appears to have gone down from 100 cases from the day before to something like 20, and I found that interesting. So, is there any reason for that? And another point, really, speaking to people in my neck of the woods, there is an awful lot of anxiety with the local GP surgery recently, and particularly when this comes to the elderly. And residents have approached me about other residents and saying that they're not getting the service that they could expect, for particularly older people in their late 80s and early 90s, where there simply is no contact, no ability to get to speak to a doctor. And I have spoken to the surgery about this, but it's not just one or two. Quite a few people have approached me about this, particularly with the older people. So I was wondering whether you've got any comment on that. Finally, again, I'll go back to Kersley. It was, of course, in the paper last week that it was the most affected area in the borough by far. We've also linked it to deprivation, as you stated earlier in the presentation. It is linked to deprived areas within the borough, and we do have pockets of deprivation in Kersley, but this is surprising. I didn't think it was one of the most deprived areas in Kersley. Do you have any, could you clear that up? Is it just a one-off? Is it just, you know, that the Kersley is not the case on that point? So I was going to say, sorry about that, it's three questions together there. Thank you, Chair.
So, Dr. Lowy first, please, for Councillor Howarth's question, and then Councillor Eslop, and then I'm going to bring in the Exec Cabinet Member, Councillor Baines.
Okay, excuse me, thank you for that. Just in relation to the question about test and trace, so we have seen our testing rates really increase over the last week to 2 weeks. And we have a testing rate of approximately 280 per 100,000, and I do say approximate because it does fluctuate on a day-by-day basis, but it is currently over the 250 per 100,000 mark. In relation to tracing, you're right, as people, you know, from a public health perspective, and the information is that people are to self-isolate for 14 days if they've been classed as a close contact. And what our advice has always been from the very beginning of all of this is to keep to the 2 metre rule, keep your distance, keep the hand washing and so on, because that is absolutely crucial to reduce the chances of being a close contact. Appreciate that can't always happen, especially with particular work environments. But again, part of the response is around keeping those really strong, clear public health messages of keeping your 2 metre distance apart when you can do. We do know that obviously it's very challenging for people to isolate for 14 days, especially when you are feeling well and healthy. You want to get to work, you want to be out, so do understand and appreciate the challenges that causes for families, and that's why the as you say, Councillor Howarth, the £500 came in has come into being from a national perspective to provide some relief for families meeting the criteria, so that they can be financially supported to isolate for the 14 days. Whole host of reasons why people may not, as say, self-isolate, because they choose not to, they don't think they need to. They feel that they can't afford to, and again, that's why we're working with communities. We're also working with the voluntary sector as well to support people to understand the importance of self-isolating. We do find that, you know, many people do respond well, and especially they respond to our local contact tracing service as well, because people do want to do the right thing as well, and to stop the spread of the virus. Moving on to the question about the cases in the presentation, I am assuming the slide the information you're referring to is on slide 2. Just to say for that is the greyed out area of the slide is incomplete data. So as we're getting the information through on the tests, and that's where it's not the complete information. So and that's why we do give. It sometimes feels a little bit old data, but it's the most accurate data, so that people have been assigned correctly through the testing process to having the test results back for that person. Also, they've been assigned with the right postcode, because if they you know, the information isn't quite eligible or something else on there, we do make sure we do everything we can to realign it into the residents of Bolton, so the postcode. So there is always a natural gap, and that greyed out areas where it's incomplete information. So please don't go just on that slide. In relation to the ward level data, I'm not quite sure of the question, if I'm honest, but what I would say is the ward level data does change quite a bit week on week. Again, this is why we don't just look at the ward level data, we look at the whole population, and we look at a number of measures. We don't just look at the 7-day rolling rate, but we look at positivity rate, we look at the testing rate, we look at hospital rates, we look at a whole range of aspects when we're looking at the impact of COVID and the trends around that. So, and again, sometimes it's the rates can be higher in more affluent wards or more disadvantaged wards, and it does change, as you'll see over the weeks. It has changed quite a bit in a number of those wards across Bolton. So hopefully I've answered your question on that one, but apologies if I haven't, and I'm happy to try and answer it properly if I've missed the question, should I say. And then I'm going to pause there, and the one that I've not answered is the one that Sue Long said she'd come into as well, but I know you wanted to hand over to the portfolio lead, so I'll pause.
Yeah, well, I'll take Sue in a moment, but if I could ask the cabinet member, please, Councillor Baines, to make her comments, please.
Thank you, Chair. It was just really regarding Councillor Heslop's point about GPs. And seeing patients, and I know that Sue Long as well, we've discussed at the CCG, and the GPs have actually, the CCG has actually presented its 6 months forward plan, where they are attempting to get more face-to-face consultations with patients, and trying to get a bit more normality. It's very difficult because we're in ever-changing times. But that's the plan, because they see this as very important. But it's also encouraging patients to engage with their own health requirements as well, and to ensure that they engage with surveillance requirements, i.e. blood tests and things that the GPs actually need them to engage with. And also there's the need to ensure that there's prompt diagnosis and prompt referrals appropriate with those residents who are actually exhibiting symptoms. So again, you know, it's vitally important that people get this prompt attention, but I do share Councillor Heslop's concerns regarding some of his constituents in his area. So thank you.
Thanks very much, Councillor Baines. Could I bring in Sue Long, please, Bolton NHS? Thank you.
Yes, just to add quickly, I absolutely understand the concerns about our most elderly and most vulnerable. And what we have is, as Councillor Baines picked up, we've agreed that for the remainder of this year, a priority for every general practice is to contact people in that most elderly and vulnerable group, and to make sure that they have managed to contact them, and to make sure that they have undertaken health check and other prescribed. Sorry.
You've broken through.
So your video's a bit intermittent. Are you able to switch your video off, and then that might help just hear you? I think we've lost her, Chair.
I think Sue has gone, so unfortunately, but okay. So we'll take some more questions now. We've got a question from Councillor Sherrington, Councillor Cunningham, Councillor Bagnall and Councillor Mistry. Councillor Sherrington, please.
Thank you, Chair. I can't see myself coming up on the... Have you got me there? Because...
You're live, Councillor, yes.
We have you.
It's just that my red line and my picture have not come up, even though I've switched the camera on. Anyway, okay. Thanks, Chair. Thanks a lot for letting me come in. All it is, first of all, I'd like to thank Rachel for answering one of my earlier questions within her presentation. Thank you very much. The other question, though, that I had was related to the local government units information that they send us on a daily basis. And it was a few weeks ago that I got this through that was saying that certain areas of the country were actually paying 50% more to care homes who were paid through the local authority, and they would get 50% more if they took COVID patients from the hospital. Now, I've just heard that on the presentation that with some of our care homes now in Bolton have got huge vacancies, and I'm just a little bit worried that they may slip into what is happening elsewhere. And I just have my concerns and worry about the people who live in the care homes, because I'm just worried in case they wouldn't be aware of whatever was going on. And so I'm not suggesting that this is happening, but I do feel that we need to keep a close eye on it. So that's what it was. Thank you very much. Bye.
Thanks, Councillor Sherrington, for those comments. Councillor Cunningham, please.
Thank you, Chair. Questions, I suppose, really, if I was going to direct them at anybody, it would probably be to Fiona Norden. There was talk of the percentage of return to normality that we were expecting to see. You did, in fairness, say that it would be, I think, challenging, and to get to 100% diagnostics by the end of October does seem very, very challenging. Particularly, I wonder if within that you're also including the more difficult diagnostic services such as endoscopy, colonoscopies, etc., 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 which seem to have been, because of the aspiration and element of it, very, very difficult to deal with. That was one area I wanted to just ask about. And the second one was, as Councillor Heslop has quite already alluded to, I do believe that there is a problem with diagnosis within the community and access to GPs, which is part of the problem. And I also believe it goes further into that, into the actual hospital, into triage, and looking slightly ahead, the mooted plans to bring in the requirement to actually book appointments to have or book appointments for A&E, which I think is perhaps counter to what anybody believes. That A&E is actually for accidents and emergencies, and that's what you go there for. If you actually have to book appointments to go there, again, I think that increases the chance of people not getting there in time with perhaps some really serious problems, which could result in more complications, or in worst scenarios even death before they get there. So those are 2 points I think that are worth discussing. And I say perhaps Fiona would like to have a look at those. I know I did talk about one of these problems in the GM meeting, and Fiona and I have still got to catch up together to discuss on that, but perhaps for the benefit of all here, I could hand over to Fiona.
Thank you, Councillor Cunningham. Thank you, Councillor Cunningham. As to diagnostics, yes, it is a very challenging time for us. We have a limited estate at the Bolton site, and we need to make sure that our patients are able to access services safely. So from a colonoscopy point of view, it's not an air-generated procedure, so we should be maximising and optimising the ability to be able to bring our patients through there. There are some areas of concern around upper gastrointestinal endoscopy because of the air generating procedures. Within Greater Manchester, we've just obtained and purchased an additional endoscopy unit that will be based out in the Northern Care Alliance, and that will has been supported through Greater Manchester Provider Federation Board. That will allow us, if we can, and if patients are happy to move to receive endoscopy services on other sites, and that's something that we need to consider when we are ramping up our activity. From an A&E perspective, I wish that patients who had accidents or emergencies would be able to access our services appropriately, but unfortunately we have a number of patients who access our services inappropriately. So the appointment for A&E will be triaged so that we can make sure that the patients who do require our services are able to access our services more appropriately, and that the patients who don't actually require accident or emergencies can be rerouted and redirected to other alternative emergency care facilities. We are seeing about 320 patients a day. Pre-COVID or during COVID, we were seeing about 150 patients a day. We have certainly ramped up our activities through our emergency department, and not all of those patients that attend our emergency department are either an accident or an emergency, and that's why we're implementing, as is the rest of Greater Manchester, an urgent care by appointment system. Thank you.
Thanks. Thank you for that, Fiona. If I could ask Councillor Bagnall to come in with a question, and then Councillor Mistry. Councillor Bagnall, please.
Thank you, Chair. My question refers to care homes. There's a lot of evidence that the mental health of residents with dementia is deteriorating due to being isolated from the family members. Are there any plans to ease the restrictions on family members attending care homes? Now, I appreciate our care homes are working hard to keep the residents safe. Now, I've been talking with a lot of families about this, and one of the ideas people have come up with is to have a designated family member who can go in, just one person out to the family, to actually see and interact with the resident, the family member, even if that means they have to wear, PPE. They get tested every week, and they have to pay for those themselves. Because I don't expect the homes to have to fork out for this sort of thing. But there is a need, I think, for allowing close family members to go and see the residents in the family in the care home. Thank you.
Thanks for that, Dougie. And I'll take the final question from Councillor Mistry. Councillor Mistry, please.
Thanks, Chair. This is for Fiona. Just a quick one. She just said that we're resuming all the services in the hospital by end of October. For some reason, when I talk to most of the BME that I work with, they have just got this notion that NHS is completely closed for other than COVID, and for the fear of COVID, they're not doing. Is there anything they have plans in doing so that they get the message across that the hospital is still running normally? Thanks, Chair.
Fiona, would you like to pick those up, please? Thanks.
Thank you. To Councillor Bagnall, unfortunately I'm unable to answer the visiting restrictions regarding care home facilities. That might be something that Rachel may be able to pick up, but I can say around the visiting for the hospital, we are looking every week regarding what we can do to support additional visiting. Visiting is beneficial for not only the patients who are with us, but also for their relatives too. So we're looking at whether or not we can allow different access for our patients who are on the wards, but also through our maternity services, so that we can support additional birth partners in to support mums. Regarding Councillor Mistry, and I didn't actually say that all our services will be going back to normal. A considerable number of them will be. There'll be some services that will be finding very difficult to resume because of the pathways of care that we have for patients. As to contacting our patients, so all our patients have been contacted, and any patients that are requiring access, we're doing everything we possibly can to make sure that they understand that the services that we are providing, they are safe to access. So it's been a challenging time for us all, but we're certainly doing everything we possibly can to make sure that the patients who can access our services are accessing them, and making sure that it's a safe place for patients who do access our service, so that we are not having nosocomial outbreaks for any patients who do need our services.
So, Rachel, would you like to come in, please?
Thank you, Chair. I will take Councillor Sherrington's question first, and apologies for not covering in the presentation. Bolton hasn't been paying care homes additional fees as described for taking COVID patients from hospital. I can provide that assurance. We are working closely with our care sector for discharge to assess pathways. So that's enabling people to move from hospital as soon as they're able into another setting where we can undertake an assessment for longer term needs. And that is something we've done for many years and is not COVID related. So we may well be block booking a number of say beds in particular homes to support that. But I can assure you that we haven't and are not considering paying kind of inflated rates for COVID. In relation to Councillor Bagnall's question, yes, care home visiting and the restrictions on care home visiting for families and residents will be having an impact on individuals across the board, some more than others. And we've had a number of relatives writing to myself and Helen as the DPH around their concerns and with ideas and suggestions. There is guidance that has come out nationally about how we could support care home visiting. At present, though, care home visiting is actually out of our control. This is nationally mandated that care home visiting is not permitted in law at present because of the Bolton and Greater Manchester restrictions. We will work with our homes and are keen to do so to enable care home visiting from family members, whether that's 1 or 2 designated members, whether that's with PPE, it will be with PPE, it will be in safe ways. We will work with them around their individual risk assessments around that. We are across Greater Manchester as a group of Directors of Public Health and Directors of Adult Services working closely to come up with a set of key principles and having discussions with the Department of Health and Social Care around the impact of this. As soon as we know anything further, whether we can lift this nationally, then locally we will work very closely to enable it to happen safely.
Thank you, Rachel.
Thanks for that, Rachel, and thanks, Fiona. I've had a request, a brief comment from Councillor Morgan. Councillor Morgan, please.
Thank you, Chair. Rachel's pretty much said what I've said. What I was going to say is, like, we can't, care homes can't accept visitors at the moment, which is unfortunate. But there is also a very an issue that goes alongside that is insurers are now withdrawing liability cover for COVID-related incidents, which makes it really difficult for our private sector partners to allow visiting. But all I want to say is the sector is getting ready to allow visiting. There's some really innovative stuff coming forward with regards visiting pods and garden visiting and stuff like that. So there's a lot of lobbying going on by the sector, both from operators, but also more importantly from families to government to try and get the visiting ban lifted, because as Councillor Sherrington said, probably particularly more vulnerable, like people with dementia, are really struggling now with non-visiting, and we should be seeing family members as part of the care team. Like I think somebody indicated, let's test them like we would do our staff, etc., and allow them to visit. But it has to be appropriate, it has to be safe, not only for the resident and the families, but also the staff. So that's all I'd like to add, really, Chair.
Thanks, Councillor Morgan, for that. I have no further questions on this particular presentation. Can I thank the officers for what was a most informative and interesting presentation, and thank all members for their well-rounded questions. And going forward, hopefully it gives a little bit of reassurance to the citizens of the borough that we have learned from the first phase of this terrible disease, and going forward we will continue to do our best to keep people safe with our partners who are working so hard at the moment. So thanks very much for that. There are no members' questions tabled, no members' business this evening. So our final item is the minutes of the various committees that have taken place. So the Executive Cabinet members, Adult Social Care and Health, held on the 15th of June, the 29th of June, the 17th of August and the 7th of September. And the Executive Cabinet member for Wellbeing, the meetings held on 29th of June, 11th of August and 7th of September, which you've had an enclosure. Would someone move that we accept those minutes?
I'll move them minutes, Chair. Thank you.
Thanks very much, Julie. Have members any questions on the minutes? There are no questions on the minutes. So that being the last item on the agenda, that concludes our business for this evening. Can I thank everyone for their participation tonight, especially the partners from the various organisations who are working so hard to try and defeat this terrible virus. For those of you who are at home, please stay safe. For those of you who have to travel home after this meeting, a safe journey home. And thank you all very much for your attendance. Thank you.
Just to say, Chairman, the next meeting's 28th of October at 6 o'clock.
Thank you for that, Mr. Mulholland. Thanks very much.
John, if you could end the live meeting, please, now. Thank you.
Thanks, everyone.